Hiatal hernia syndrome, the hidden factors doctors can miss. So you're wondering if you have hiatal hernia, but you're not being given that diagnosis. Why is that? There can be so many different symptoms associated with this problem. Acid reflux is often where it starts, but then you have bloating, you have gas, you have constipation, but then you're also feeling short of breath. You can have heart palpitations, anxiety, panic attacks, and trouble swallowing, regurgitating your food, you have trouble sleeping, you can even have tingling into your arms and hands, chest pain, pain around your back. It's a lot of different symptoms, and that's where it gets confusing because then you're sent to specialist after specialist, and each one is perhaps giving you a drug, palliative, meaning it's trying to help your symptoms, and your symptom might improve, but the root cause is not being addressed. And so it's not that your doctors don't care, they do, but what are they constrained by? They're constrained by what's the diagnosis and make sure that they're giving you what's the approved treatment. So when you go to the cardiologist, which you should do when you're having heart palpitations, shortness of breath, pressure and pain in your chest, which are all symptoms of course, our number one killer, heart disease, but they're also symptoms of hiatal hernia syndrome. So when you go to that cardiologist and he or she gives you a clean bill of health on your heart, that's great because, you've ruled that out. But they can also give you a medication, even though you don't have heart disease, they can give you a medication to slow down your heart because you're having heart palpitations, you're having rapid heart rate, and that drug will do that. It'll slow down your heart. Is it getting to the root cause of the problem? It's not. So then you go see a pulmonologist because you also have shortness of breath, and they check out your lungs and they say, your lungs are fine, but let's give you a drug that's for asthma, just sort of opens up your breathing passages, your bronchioles, so that might help with your breathing. That one doesn't have good success in the patients that I've spoken to, but you're given that medication. Then, of course, the easy one is you have anxiety, and that's all too readily, you're given an anti-anxiety or antidepressant medication. And let's not forget where it typically starts, which is acid reflux. Again, that's an easy one. Oh, you have acid reflux. Here's your PPI, your proton pump inhibitor medication. And is that going to make you feel better if you have classic acid reflux? Yeah, because it's going to diminish the amount of acid in your stomach. So these palliative treatments can definitely offset the symptoms. But the problem is not only are they missing the root cause, in the case of the PPI and the anti-anxiety medication, they're actually worsening the root cause. And doctors don't know this. They don't, if you ask your doctor, I've had a lot of patients report back to me that, I asked my doctor about, what about these PPIs? I've been on them for years now. And it's like, well, you can't have acid reflux, you can't have your esophagus destroyed. And that's their viewpoint. And I understand it because that, they're constrained by their niche, right? This it's called the siloing of medicine, where everybody has their niche, and they think within the constraints of that and not anything else. But with hiatal hernia syndrome, you've got to stand back. Now, in the description of this video, I will have a number of different references, research references cited. And I loved the fact that they talked about, I'm going to look at my notes, the fragmented aspect of specialty care, meaning that you're seeing all these specialists, but nobody's talking to one another. They're not saying, well, I'm seeing this, what are you seeing? And it's like, so Mary has, rapid heart rate, but she doesn't have heart disease. Oh, and she's also complaining of shortness of breath. You've checked out her lungs? Yeah, I couldn't find anything there either. Unfortunately, the go-to at that moment, if they were talking, which they're not, but if they were, then the go-to was, well, she's also anxious. It's probably the stress. That's probably what it is. It's an unfortunate fallback that medicine uses. Like, oh, well, it's all psychiatric, it's all stress related, it's all in her head. And that's unfortunate because hiatal hernia syndrome really does create psychiatric symptoms of, anxiety, panic attacks that are not emanating from your head. It's not all in your head, and it's certainly not from just stress. So as I said, these references that I have, these researchers spoke to that, and they talked about the fact that patients are treated piecemeal, which I also loved, because that is the problem. It's like, here's the thing for the heart symptoms, here's the thing for the breathing problems, here's the thing for the digestive symptoms, but nobody's pulling it all together. So how do we pull it all together? We look at what's happening and why. So it's a physical change. The stomach is being compressed, and because it's being compressed, which it shouldn't be, it also elevates, which it should not do. When it elevates, what does it run into? Smack dab into your diaphragm, because the stomach is just naturally just a titch below your diaphragm on the left side of your body, just left of center. So it pushes on that diaphragm. Now that diaphragm can't move as freely as it should. It's being interrupted in its function. And so you get short of breath. Also, because not enough oxygen is coming in. It's not optimal. It's not optimal oxygen level. Are you still breathing? You are. But, when you're, I see patients over Zoom, new patients, and they're, you can see them breathing, which until I just did that, I've been talking to you for several minutes. You haven't seen me breathe, right? I haven't labored to breathe. But that's what these patients look like when they're suffering. They've got a lot of attention on getting a breath because they call it air hunger. They're just running out of air because that nice fluid movement of that diaphragm is not occurring. So anyway, the diaphragm spasms, you're not getting as much air as you should. Your nervous system goes, uh-oh, that's not good. And it sends out a bunch of stress hormones, and you can feel anxious and you can start feeling panicky because it's trying to get your attention to say, there's not enough oxygen coming in here, do something. It's like your smoke detector in your house. Why is it there? Because where there's smoke, there could be fire. And from your nervous system's perspective, where there's not enough oxygen, there could be death. So we need to do something. So that's where that panic comes from. Now, what about your heart? As your stomach compresses and pushes up into your diaphragm and your diaphragm elevates, your heart is just right there. It's right above your stomach and diaphragm. Again, just a little left of center. And so the heart has a sac around it, and when you compress that, when you elevate into it, it can start, the heart palpitations. So that's the mechanics, that's the physical change that occurs in the body. There's also, in other words, just the position of everything is changing, and that's altering function. And of course, it's creating acid reflux, etc. But the other aspect of this is nervous system related, because your vagus nerve, it is called, is your longest cranial nerve. It comes out of your brain, but it goes to all your digestive organs, but also goes to your heart to make it work, and your diaphragm, and your esophagus, etc. And when your stomach compresses and moves up into the diaphragm, the vagus nerve gets irritated, that is innervating or making the diaphragm work. When that happens, you can get an alteration of different, they're called sphincters or valves, and they let food pass, and they cause, because what's happening with acid reflux and hiatal hernia are things are moving in the wrong direction, right? It should be from up, down. You chew your food, you swallow, it goes down your esophagus. Then it's in your stomach. Then it goes down your small intestine. Then it goes down your large intestine. It's a unidirectional. It's only supposed to be top down. You're not supposed to vomit. You're not supposed to have acid reflux. Your stomach's not supposed to move up. Your heart's not supposed to, freak out. But these are all, the motion is in the wrong direction. And the vagus nerve helps these valves open and close and keep things pressurized in that down direction. And so when the vagus nerve gets irritated, these valves are not working the way they should, and you can get the acid reflux, the diaphragm not working well, but also because the acid in the stomach is coming up into your esophagus and irritating it, there's a reflex, not reflux, but reflex. There's a reflex that occurs between your stomach and your heart due to this irritation, and your esophagus and your heart due to this irritation. So you can get heart palpitations due to this reflex, in addition to, so this is the nervous system aspect, in addition to the mechanical or physical structural change that I was just mentioning earlier. So there's a lot of things working against this normal flow and normal function of these body parts. So But what's interesting is that, then you have to step back and go, why? Why is the stomach compressing, right, and elevating? That has to do with your overall digestive health. Inflammation, increased pressure, constipation, the alignment of organisms in your colon, good bacteria versus bad bacteria. You can have infections, you can have toxicity levels like mold and heavy metal. All of these things that are disrupting your normal gut function is creating increased pressure, compressing the stomach, pushing the acid up, and then you get your cascade of all these different symptoms. So I mentioned, to tie it together, I mentioned the fact that the PPIs and the anti-anxiety medications actually are worsening the root cause, because PPIs are known to worsen, make more bad bacteria than good bacteria. It's not my opinion. There's oodles of research to support this. Similarly, anti-anxiety meds, antidepressant meds also disrupt your gut. The good bacteria versus bad bacteria. They act as a mild antibiotic, which is incredible. So you see the drugs that you're being given to sort of calm the symptoms are actually worsening the root cause. And you want to get to the root cause to really fix this and not have to just keep putting up with these symptoms and the side effects of drugs. Drugs always have side effects. It's like you have to decide if you want to put up with them or not, but what if you didn't have to? You see, that is an option, which a lot of people don't know. So finding a clinician who really understands this and can really help you is my urge for you. Now, are some hiatal hernias large and they need surgery? Yes. Can you have the kind where it's called paraesophageal, where the stomach is pushed up instead of into the esophagus, alongside the esophagus? That can be dangerous. That can require surgery for sure. Yeah, there's a place for these things, but what I'm talking to you about is these symptoms that are not being addressed. You keep putting up with them and you wonder, why is nobody tying it together? And that's why it's just a bit of a liability of the system, but it's not that your doctors don't care. So I hope you found this helpful. If you did, like, subscribe, send me a comment. I love your comments. I answer pretty much all of them, and we'll talk soon.